I'm Dr. Tamu Davidson, Director, Non-Communicable Diseases and Injuries Prevention at the Ministry of Health, Health Promotion and Protection Branch. Well, childhood obesity is a medical condition, and we define it using the body mass index. And using the body mass index, we measure childhood obesity depending on the age range. And the reason is that in this age group, as you know, the child is developing, and so that those physical changes will change over time and are quite dynamic. This is very different from the adults, where we use a body mass index to also define adults. And just as a reminder, the body mass index is the weight in kilograms divided by the height squared. And so in adults, we use the body mass index and a special chart which defines whether they fall within the overweight, obese, or underweight category. The health consequences are many, and this is why not only Jamaica but the world is concerned, is alarmed at this epidemic of childhood obesity. So the consequences can be both physical and psychological. The physical consequences, we know in the long term that once a child is obese, they're more likely to be obese adults. So we say obesity begets obesity. We know that obesity is a high risk factor for diabetes and a risk factor for hypertension, for heart disease. There are other consequences such as it impacts on their musculoskeletal, so it affects their joints, it affects their breathing as well, puts them at greater risk for issues related to asthma. Their mental health consequences, because many of the children, because of them being overweight or obese, they suffer from poor self-esteem. Very often these children are bullied as well in school. So there are many health consequences, and based on the current evidence that we see, even in childhood or in adolescent age group, if they're overweight or mainly obese, if they're obese, we know that they're increased risk even at that age group for having type 2 diabetes. So what we see is that we may be looking at schools where they're not only concerned with trying to give children a good education, but they're going to be looking at schools where children are no longer healthy, and they have many children who have type 2 or type 2 diabetes or hypertension. So there's no one solution to addressing childhood obesity, and the ministry and the rest of the world, we have recognized that, and so we have a multi-pronged approach. So firstly, there are about 6 critical areas, and one is that we address childhood obesity from the pre-conception stage. So from the stage where a woman is pregnant, before she gets pregnant, and during pregnancy and after pregnancy, because we know that the health of the mother can impact on the fetus in utero. So it's important that we manage these diseases before women get pregnant in their reproductive age group, during pregnancy and after. And this also goes for men as well. Their changes through counseling and helping them with trying to make the necessary adjustments. Along with in the school setting, we have also been promoting physical activity as well, that we ensure that our children are engaged in physical activity. So their support through our health facilities. Once a child is assessed as being overweight or obese, then they really need to be seeing their medical doctor, whether that is in a public or private setting, and they need to be getting the nutrition counseling so that those two can go hand in hand, because they have to be assessed to see if they have any underlying disease as a result of them being obese and overweight. So just to say, in our fight against childhood obesity, it's not just one intervention that the Ministry of Health has embarked on. As you know, there are multiple prongs, and I'd just like to sum that up again in trying to help individuals understand the importance of their health, trying to help the parents understand the importance of their health and the consequences of childhood obesity and what they can do, but also trying to create safe spaces and a supportive environment. And some of our key flagship programs has been the Jamaica Moves program, which looks at really addressing healthy eating, physical activity, and doing age-appropriate health checks. A part of that is our intervention in schools. We also have our infant and young child feeding policy, which helps to support really good healthy practices right from birth. So this problem is something that has to be addressed right throughout the life cycle, and we say from the womb to the tomb. So childhood obesity prevention starts from early in life, from the mother, from conception, preconception stage, and it's an ongoing intervention.